It's alive!
I tell you, gentlemen, science has agreed that unless something is done and done quickly, man, as the dominant species of life on Earth, will be extinct within a year.
Is there any type of gas we could use?
No, we can't take a chance. It might poison the whole city.
Keep away!
This woman is about to learn a terrible secret. She will never be the same again.
This woman's got MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. MRSA is not fundamentally different from other strains of staph infections. MRSA infections can be treated successfully, but it requires powerful and toxic antibiotics. It is not more virulent or longer-lived. It, however, does not respond to common antibiotics. MRSA infections are now responsible for more deaths in the United States of America than AIDS.
Hi, Mrs. Lambert. You've got MRSA.
What's that?
Well, it's a bacterium that causes infections to different parts of the body.
So how are you feeling today, Mrs. Lambert? Well, I noticed a little redness in your arm today. We'll have to take a look at that.
Most MRSA infections are skin infections that produce the following signs and symptoms. Infection of the skin or the fat and tissues that lie immediately beneath the skin, usually starting with the small red bumps in the skin, boils, abscesses, collections of pus and under the skin, carbuncles, infections larger than an abscess, usually with several openings to the skin, and impetigo, a skin infection with pus-filled blisters.
Normal skin tissue in people usually does not allow MRSA infection to develop. However, if there are cuts, abrasions, or other skin flaws such as psoriasis, MRSA may proliferate. Many otherwise healthy individuals, especially children and young adults, do not notice small skin imperfections or scrapes and may be lax in taking precautions about skin contacts. This is the most likely reason MRSA outbreaks occur.
One major problem with MRSA is that occasionally the skin infection can spread to almost any other organ in the body. When this happens, more severe symptoms develop. MRSA that spreads to the internal organs can become life-threatening. Fever, chills, low blood pressure, joint pains, severe headaches, shortness of breath, and rash over most of the body are symptoms that need immediate medical attention, especially when associated with skin infections.
This resident's got MRSA.
Contact isolation should be commenced immediately when someone has MRSA. Individual rooms should be preferred, and they should also have their own toilet facility. The door must be kept closed at all times. If there are several affected patients, a small ward with designated staff is preferable to side rooms of different wards. In an outbreak situation, the infection control unit will consider the cohorting of patients. Prior to transferring the patient to the side room, the implications of MRSA colonization, infection, and treatment should be clearly explained. Only one visitor is allowed, who must carry out all necessary precautions and exit the ward immediately after leaving the room.
Strong antibiotics are used to treat MRSA because of the oral absorption of vancomycin is very low. These agents must be administered intravenously to control stomach infections. Treatment of MRSA infection with vancomycin can be complicated due to its inconvenient route of administration.
Isn't it enough that 2 men are dead? Do the rest of you want to die too?
Madam, I know what I'm doing.
After finishing with the resident, remember to remove dirtiest first. Therefore, appropriate handling of laundry. Handle, transport, and process used linen to avoid contamination. Remove gloves, remove gown. Remove eye protection. or nose protection, and finally hand protection.
Careful hand washing remains your best defense against germs. Scrub hands briskly for at least 15 seconds, then dry them with a disposable towel and use another towel to turn off the faucet. Carry a small bottle of hand sanitizer containing at least 60% alcohol for times when you don't have access to soap and water. Keep personal items personal. Avoid sharing personal items such as towels, sheets, razors, clothing, and athletic equipment. MRSA spreads on contaminated objects as well as through direct contact. Keep wounds covered. Keep cuts and abrasions clean and covered with sterile, dry bandages until they heal. Sanitize linens. If you have a cut or sore, wash towels and bed linens in a washing machine.